already seeing cases rising across Europe. Globally, there have been more than 16.5 million confirmed cases and 655,000 deaths. The US has the most confirmed cases in the world and have seen their biggest daily increase since May, with 1,300 deaths. According to the latest weekly figures, they have 136 cases per 100,000 people. Brazil has even more, with 153. South Africa is suffering too, with 133 cases per 100,000. Europe's numbers are nowhere near as high now, but some countries are seeing new clusters. There are 27 cases per 100,000 in Spain. In France, 9 and 7 here. In parts of Asia that had early success in suppressing the virus, cases are rising again. Like Singapore, where there are 47 per 100,000, and in Hong Kong, a rapid rise in infections has led the authorities to say hospitals could be on the verge of collapse. Well, earlier I spoke to the Conservative MP Geoffrey Clifton-Brown, who's Vice Chair of the Public Accounts Committee, Professor Carl Heneghan, who's an urgent care doctor and epidemiologist at the University of Oxford, and Nadra Ahmed from the National Care Association. I began by asking how we prevent mistakes made in handling the pandemic from happening again.
Well, I think we've got to have the lessons learned. And I think what's really worrying for me is even today, I'm hearing from providers who are telling me that they're not being able to access tests. And I think that's really worrying. And I think we've got to get that resolved, because if homes are not getting the tests have been withdrawn, and we've got all sorts of issues going on. So that's the biggest lesson we've got to learn in order to mitigate the risk now which the second wave could bring. We've got to make sure that testing is available. We've got to make sure social care has parity. So if we're going to keep the NHS safe, we must keep social care safe as well. And our staff are frontline. So, you know, we need that PPE. We need to be able to support the people that are in our care. And the only way to do that is to actually put us at the forefront of their minds rather than the background.
Geoffrey Clifton-Brown, based on what you've just heard, who is taking responsibility to make sure that the same mistakes aren't made again?
Well, that was part of the reason for our report. We have now published our report. We've made some very critical recommendations deliberately so that we can try and learn those lessons. And I believe we are learning those lessons. I went the other day to one of the testing stations in Gloucestershire. There was huge capacity there for testing. So I believe that if we, God forbid, do get another spike, I think we will be much better equipped second time around than we were first time around. And I entirely agree with the professor's comments. We must make sure that the care sector has parity of treatment with the NHS. And one of the points that our report makes is that it's now incumbent upon the government to come up with a long-term funding mechanism for the social care sector. For far too long, it's been underfunded, and our elderly people in care homes need the dignity of a proper and safe treatment in those homes.
But are you confident in the government's plan for the next wave when it may come?
Yes, for this reason, the committee makes it very clear that since the building of the Nightingale hospitals, the capacity of the NHS in terms of beds and in terms of ventilators and in terms of PPE and in terms of knowledge of the virus is very different now compared to what it was at the beginning of March when the virus was at its height.
Professor Heneghan, the Prime Minister has talked about Europe experiencing a second wave. We are now seeing a rise in cases in several countries where it was believed COVID was under control. What is your assessment of where we stand now?
Look, it's important to remember two things. When we talk about a second wave, we're talking about the impact on morbidity and mortality, the impact on hospital admissions, on rising deaths. At the moment, that is not occurring. What we're seeing as we test more and as we open up more, yes, we're going to pick up more cases, but it's incredibly important not to panic now, overreact. So we are going to see these rises, but it's important to focus on the data that matters, hospital admissions and deaths. And all of that data is highly reassuring at this moment in time.
So, Nadra Ahmed, we've just heard there that Professor Heneghan believes the data is reassuring. Do you feel reassured about what's happening in care homes?
I think we still need a lot of reassurance. And I think one of the big issues we now face is where we've had homes that have had a number of deaths. There are voids. People are not choosing to come into care homes as readily. So the viability of care services are going to be challenged. We need a robust and a sustainable social care sector in order to support the NHS. And I keep saying that. And until that message gets through, we're not going to crack this one.
Geoffrey Clifton-Brown, you have raised some very serious concerns today. Do you think there needs to be a more in-depth process, perhaps an inquiry to work out what went wrong the first time so that the same mistakes aren't made?
Well, we've made some pretty tough recommendations with specific short time scales on them. The government have to reply within a specified period. Let's wait and see what they reply. And if they are unsatisfactory replies, our committee will undoubtedly hold a follow-up hearing, certainly in this year, probably before Christmas. And let's see what happens. But I think at the moment, the facts are pretty clear. What we need to make sure is, as your professor said, we learn those lessons. And if we, God forbid, have another spike, we are much better equipped than we were first time around. And I entirely agree with her that we do need to make sure that care homes are viable. And one of the reasons that the government gave the £3.3 billion to local authorities was so that they could increase their rates to care homes. A number did, some didn't. And I think we want to make sure that there is equality across the piece.
Nadra Ahmed, you're shaking your head there.
Yeah, I mean, I think the 3.2 billion was released from central government. Sadly, it did not hit the front line. The sector did not see it because it was released to local authorities for their priorities. And many local authorities did not see it as a priority. So a lot of that money did not come to social care.
Well, Geoffrey Clifton-Brown, we're hearing there once again that the reality doesn't match the theory. So perhaps what we need is someone holding the government to account, and maybe an inquiry process is the way to do that.
Well, honestly, I think really the priority at the moment has been getting the nation over this COVID process. We can have an inquiry, it'll take years to report. What we need to do is make sure that there is the proper protections in place. And I do slightly disagree with your previous contributor. Quite a lot of that money has gone to local authorities, and quite a lot of local authorities have increased their rates to care homes. And on top of that 3.3 billion, there was another 600 million pounds that was specifically ring-fenced for the care sector for infection control. So, I mean, really, quite a lot of money has reached the care sector. And we need to make sure that we can make sure it's robust going forward should we have another spike.
Professor Heneghan, what do you think about calls for an inquiry?
Well, look, I think there's lots of debates here. That it's important we still focus. We're in the midst of this problem. So we have to find solutions right now. We can look to countries like Hong Kong, who really understood after 2002, 2003, when they had lots of problems in their care homes. They sorted that sector out. They had training, on-site training, 3-month stocks of PPE, and also a specialist clinical team that goes into care homes as opposed to people coming out of care homes. So we really need now concerted action. I think the time will come for inquiries, but it's not now. That will be when we get out of this current problems, and then we start to look at who was at fault, who's to blame. But right now, we have to think about the solutions.
And you've been quite critical of the idea of lockdown in the past. So do you think that the government shouldn't resort to using a lockdown in future?
What you're looking to do here is to do intelligent mitigation. Look to those bits of society where you can slow the virus down when it's causing problems with admissions, with deaths. And if you do that really well and have a functioning test and trace system and shield those most at risk, you will be able to manage without a lockdown.